So what are the things we can do to prevent hypertension? There are a lot of things that we can do lifestyle-wise that will prevent us from ever developing hypertension, especially if we have a family history of hypertension. If you have a family history, a close relative, a parent, a sister, a brother, or uncle or auntie who has hypertension, chances are that your risk for developing hypertension is increased. And that's one of the things that we need to take note of from a very early age. Number one is to control the amount of salt in our diet. It's important not to eat too much salt in our food. Salt includes seasonings like the stock cubes that we use in our food. So moderation with salt. Adding extra salt to the food is also not encouraged. Exercising regularly is very, very important. What is recommended is 30 minutes of exercise 5 times a week, or 2.5 hours or 150 minutes of exercise a week. And the exercise should be moderate level exercise, the kind of exercise that will get you sweating and will increase your heart rate. So brisk walking, jogging, skipping, dancing, which I love to do, some swimming, playing football, table tennis, badminton, they are all forms of exercise. So we should try and find at least 30 minutes in a day to do some exercise. So eating moderately is important to maintain a healthy weight. Your BMI should be between 18 and 25. For Africans, we can even leave it up to 27 because we tend to be a bit heavier. But your BMI should not be more than 27. And it's very important also to get enough rest, enough sleep. You cannot cheat nature, and if you don't get enough sleep, it may affect your blood pressure. Another thing is to check your blood pressure regularly. At least once in 3 months, you should have a blood pressure check done. Eating fruits and vegetables is also known to help reduce the risk of hypertension and heart disease. So having a healthy diet. Now, if one is diagnosed with hypertension, it's not the end of the world. There are lots of people, 1 in every 5 people worldwide has some degree of hypertension. So it's not the end of the world. What is important is to make sure that high blood pressure is adequately controlled at all times. And how do we control it? In the early stages of hypertension, medication may not even be required. Things just like reducing salt in your diet, losing excess weight, exercising regularly are known to actually lower blood pressure levels in mild hypertension and can be enough treatment for a person. However, if the blood pressure is not adequately controlled with lifestyle changes, then medications need to be started. And most of the time, you would start medications at a low dose, usually 2 medications you start for starters, and that needs to be constantly checked to see if until a good control of blood pressure is achieved. So it's very, very important to see a doctor, have your blood pressure checked regularly. If it is high, you start with lifestyle changes. If it persists to be high, then medications will follow. And sometimes some investigations, some tests may need to be done to check the function of your kidneys, to check the function of your heart, and to be able to know that that this hypertension has not already caused any damage to those organs, because that may also require some different or separate treatment. So in a nutshell, hypertension is a very, very common disease, and it's something that can be easily controlled with proper treatment, which includes lifestyle changes and medications. It's important to know that hypertension in 90% of people does not have a cure, and many people tout cures which for most of the time do not work. Lifelong medications may be required, and what we always need to remember is to weigh the pros and the cons. The pros being that with these medications we can live a good life and not have any complication. The cons being You don't need to take medication, but you may end up having life-threatening illnesses that will cause distress both to you and your loved ones. So let's remember to check our blood pressure. It's one of the things that we must know, and know when we say know your numbers. We'll talk about all the numbers we need to know on another day. I hope this has been informative and educative to you. We love you. We believe that life is worth living and living well. In Ayuna, we're all about living because life is important to us and life is worth living well. We want you to know that taking care of your body is one of the greatest investments that you can ever make. Thank you, and we'll see you again some other time.